Our third speaker is Dr. Crystal Heath. Crystal is a Los Angeles-based shelter veterinarian, executive director of Our Honor, a nonprofit that supports veterinary students, veterinarians, and animal professionals in speaking their conscience. She's also on the board of LEAP, Leaders for Ethics, Animals, and the Planet, which aims to transform today's youth into the humane leaders of tomorrow who advocate for and work towards an equitable future for all living beings on the planet. Dr. Heath is also on the founding committee of Veterinarians Against Ventilation Shutdown. Dr. Heath was named one of Vox's 2023 Future Perfect 50, which honors the scientists, thinkers, scholars, writers, and activists working on solutions to today's and tomorrow's biggest problems.
My name is Dr. Crystal Heath, and we are right now experiencing a really bad flu season. Hospitals are overflowing with influenza, COVID, RSV cases, and schools are closing due to the surge of illness. And right now, the CDC is ordering accelerated subtyping to determine how many of these cases are H5N1. Why do we care? Well, it's because the dairy industry and the poultry industry is experiencing an unprecedented outbreak of H5N1 avian influenza. And this has led to infections in humans. And as of today, there are 959 dairy herds across the US that have tested positive for H5N1. And since the outbreak began, the headlines tell us, don't worry, the milk supply is safe and the risk to the public is low. And we are told repeatedly that pasteurized milk is safe. Why this constant reassurance? The mainstream media rarely leaves any room for nuance, and no one wants to be accused of being an alarmist, which feeds right into corporate goals to quell public fear and maintain consumer confidence. Studies like this that might weaken consumer confidence and harm corporate profits don't make the news. While we don't have any confirmation that anyone has gotten sick from drinking pasteurized milk, this research found that there may be the possibility of viral resistance to thermal pasteurization. And these researchers say a stronger pasteurization regimen in terms of temperature and duration of thermal treatment is recommended to inactivate such potentially infectious virions in food products. And there's been a lot of news about raw milk. Robert F. Kennedy Jr., who is the choice to head the Department of Health and Human Services, told an audience in June of last year that he only drinks raw milk. Raw milk has led to the death of cats. In fact, the first sign that a dairy is infected is when cats die after drinking the unpasteurized milk. The mortality rate in cats is reported to be as high as 89.6%. And late last year, 5 cats even died after drinking H5N1 infected commercial raw milk from Raw Farm. As a result of finding H5N1 in their milk, Raw Farm's products were recalled and the sales were suspended. But Raw Farm insists that there are no illnesses associated with their products and that this is purely a political issue, which is what you do when your profits are at stake. And I have been hearing anecdotally from veterinarians of cats that cats are getting sick from each other and humans in that same household are getting sick. And just yesterday, the CDC posted some data indicating that cats may be able to infect each other and their humans. And this table was the deleted table from the report. And they say in one household, an infected cat might have spread the virus to another cat and to a human adolescent, according to a copy of the data table obtained by the New York Times. The cat died 4 days after symptoms began. In a second household, an infected dairy farm worker appears to have been the first to show symptoms, and the cat then became ill 2 days later and died on the 3rd day. And in every news story, we are reassured that the risk to the public is low. But at what point is it not? In the CDC's recent morbidity and mortality weekly report, they found that 7% of dairy workers tested seropositive for H5N1. This means that 7% of these dairy workers had antibodies against H5N1 in their blood. So they may have been exposed to the virus at some point and didn't show symptoms. And when workers don't show symptoms, this makes surveillance via testing especially crucial. But workers are scared to be tested for a variety of reasons related to immigration, as 50% of dairy workers are immigrants, and potential loss of work income. And I was recently interviewed for this article in Salon about a study that was supposed to be released by the CDC regarding serological data of dairy veterinarians. And this information is important to further understand the risk of transmission to dairy vets. Unfortunately, because of the communication freeze, that webinar was not held and that data was not released. So we still don't know the results of that study or how seriously dairy vets should take H5N1. And I was recently at a veterinary conference, and the dairy vet who was talking about H5N1 admitted that he still doesn't wear PPE. So how does influenza jump species? Different species have different sialic acid receptors, which are the cellular entry points for flu viruses. Birds prefer alpha-2,3 linked sialic acid receptors, which are found in their intestines. Humans prefer the alpha-2,6 linked sialic acid receptors, which are found in respiratory tracts. Pigs have both types, making them ideal intermediates. And they can be infected with both avian and human influenza viruses, which lead to a reassortment that produces strains capable of infecting humans. Influenza viruses are made up of these 8 segments of RNA. And when a host like a pig or bird or human is infected with multiple strains of influenza at the same time, the viruses can swap gene segments, creating a new strain of potentially pandemic potential. For example, the 2009 H5N1 swine flu pandemic result from a reassortment of avian, swine, and human flu viruses. Dairies are a great environment to transmit influenza to humans. The H5N1 virus is found in high concentrations in the mammary glands of cows, and in the milking parlor, you have aerosolized raw milk that can easily get into the eyes, especially if you rub your eyes after touching milk. And we were told that the infected workers had mild conjunctivitis. And when you hear mild conjunctivitis, you might think of like red eyes from allergies, but this is what they actually look like. And this isn't just mild conjunctivitis. This is more severe subconjunctival hemorrhage. And sadly, a patient in Louisiana died after handling dead poultry on his property. This H5N1 virus was identified as the D11 genotype, which has been detected in wild birds and in poultry, but until recently had not been found in cows. This same genotype was found in a British Columbia teen who was severely ill and hospitalized for several weeks before recovering. This is a radiograph of her chest. Her lungs are completely white when it should be black, filled with air. She was placed on ECMO, which is extracorporeal membrane oxygenation, which is a heart and lung bypass machine. This is very serious. And if human-to-human spread became possible and we were having thousands of people with this severity of disease, we would not have the resources to treat them. Now we just found D11 in dairy cows, and this is a game changer, yet some researchers were once again caught completely off guard by this new development. This New York Times piece reads, "Scientists believe that it initially jumped to cows from birds about a year ago, somewhere in the Texas Panhandle. That transition took scientists by surprise, and this new one even more so." John Korsland, who's a former USDA scientist, says, "I can't overemphasize what a big deal this is. This is truly an S show unfolding into a nightmare scenario. And we have no idea how widespread this version of the virus already is in cattle herds. Every time poultry flock breaks with the virus, we'll need to investigate cattle contacts, as well as wild bird and other poultry contacts." Michael Osterholm, who's the director of the University of Minnesota's Center for Infectious Disease Research and Policy, has been very insightful throughout this outbreak. And he says, "I am not surprised that we're seeing additional introductions, particularly given the very widespread nature right now of H5N1 in migratory waterfowl throughout North America. From a containment standpoint, it just points out that this is not going to burn itself out." And that quote is a callback to June of 2024, when Eric Diebel of the USDA repeated to scientific experts what USDA Secretary Tom Vilsack had said, that the virus was just going to burn itself out. I was interviewed by Catherine Eban of Vanity Fair for this article that describes the silencing and retaliation veterinarians faced for trying to communicate and do their job. And it seems corporate profits and maintaining consumer confidence in the industry took precedence over public health. I co-authored this article in Time magazine that goes into how government and industry seek to maintain consumer confidence and ignore many of the red flags associated with this model of intensive animal-based protein production. It dives into just how the number and severity of infectious disease outbreaks are getting worse, yet the industry always seems to be caught off guard and having to resort to cruel or dangerous practices in order to deal with the problem that they created. But a major problem is the government organization charged with regulating the industry, the United States Department of Agriculture, doesn't actually have a directive to ensure a safe and accessible food supply. Instead, it has a mandate to protect corporate interests and expand markets for animal-based protein production. So even scaling down the poultry or dairy industry and redistributing subsidies to support animal-free methods of food production would go against their mandate. And this is a disturbing statement from Scott Gottlieb, a former US Food and Drug Administration commissioner. And he says, there's always this tension between human health people and animal health people. The human health people would swab anything. Animal health people worry more about the economic implications. And should that be our reputation as veterinarians who should be caring advocates for animals? Should we prioritize economics over public health and animal welfare? Throughout this outbreak, the USDA has protected corporate interests. They want to dampen any concern that might lead to decreased consumer confidence. They jumped the gun and reported early on that the cows were not transmitting the virus to other cattle within the same herd. This claim was eventually refuted, and they found that there was cow-to-cow spread in dairy herds and that the virus can even spread from dairy cow facilities to nearby poultry facilities. This is a picture that I took in Wasco, California. The facility on the left mass exterminated more than 1 million egg-laying hens due to HPAI, and the facility across the street on the right is a huge dairy. I noticed that in the media, there were no photos of sick and dead cows. So I traveled to the Central Valley of California to see if I could find any evidence for myself. And I found sick and dead piles of cows on the side of the road. There were no signs anywhere warning people of the public health risks. And I called the California Department of Food and Agriculture to voice my concerns about this, and they seemed not to care. And this is a photo that a colleague shot of workers at that same egg facility cleaning up after the depopulation. This person is not wearing a mask. And this person was wearing a mask incorrectly below the nose. So trigger warning for the next few slides, there are pictures of dead cows, sick cows, and aborted fetuses. And these are the photos that I shared with the media. This is a photo of the dairy across from the big egg facility in Wasco, California. You can see birds everywhere, and this cow was laying down, dribbling urine with a cow in the background with nasal discharge. And the other cows were seen aborting fetuses. I found these bodies on the side of the road in Hanford, and this producer confirmed that they had avian influenza. This is a photo that ended up in Vanity Fair, and this was taken in the beginning of October in Tipton, California. There were flies covering the bodies, and I wondered if flies were perhaps facilitating the spread of H5N1 and wondered whether it would be beneficial to require the bodies to be sprayed with fly repellent. A journalist went out there after I sent the photos and found another body lying here, and also found a dog sniffing around the body. But that detail did not make it into the media story. But the producer did confirm that these cows had avian influenza. This is a facility in Tulare, and in this photo, you see one cow with nasal discharge, and in the background, there are 2 aborted fetuses covered with flies. Here's another shot of a cow with nasal discharge lying down and seeming to have difficulty breathing with the 2 fetuses. This is another dead cow I found in Tulare nearby to that facility. The industry says that they have to leave the bodies out on the side of the road for rendering trucks to pick them up without going into the facility and risking disease spread. But that doesn't explain why they are uncovered and why there are no signs anywhere warning of the risk. And this is a cow in Buttonwillow, California. And I noticed she is passing placenta, either giving birth or aborting. And these were dead cows outside that same facility. So what are the laws about carcass disposal? The California code reads, animal carcasses from animals on pasture or rangeland shall be managed so as to prevent the creation of excessive vectors or other adverse public health well-being conditions. When we have this many animals all getting sick and dying at once, there are no safe ways to dispose of the bodies and prevent disease spread. So we sent a letter to the California Department of Food and Agriculture recommending that they cover the exposed carcasses and apply fly repellent and post biosecurity signage, warning the public of the risks. They didn't respond to our letter, but they later did send this advisory telling producers that dead stock should be collected and stored in a manner that prevents attraction of wildlife, rodents, and other scavengers. And only if pickup is delayed more than 24 hours should they use temporary barriers like straw or a tarp to minimize scavenging. These are the number of species that have been affected by HPAI: red fox, skunk, mink, raccoon, bobcat, possum, coyote, bears, badgers, seals, and sea lions and cats all experience neurologic symptoms. This shows the number of species within each family affected. But despite the fact that the virus has infected so many different species, when it finally hit dairy cows, the American Association of Bovine Practitioners wanted to rename it bovine influenza virus A, saying, "We believe it is important for the public to understand the difference to maintain confidence in the safety and accessibility of beef and dairy products for consumers." As veterinarians, we take an oath to protect public health and animal welfare. We do not take an oath to protect consumer confidence in beef and dairy. Many scientists spoke out about the bovine vet's decision and move to rename the virus. The International Society for Infectious Diseases said, let's stick with calling it influenza A, H5N1, and worry about dealing with real problems, not misleading the general public or even giving anything close to the appearance of doing so. It was just 2 months ago that this report was published showing that just takes a single mutation to cause bovine influenza H5N1 to switch specificity to human receptors. And a few months before that, they found that these recent mammalian strains are better able to become airborne. They found in the British Columbia teenager who was placed on ECMO that the virus had developed the PB2E627K mutation, which is a mutation linked to faster replication in human cells and greater severity of illness. And this mutation likely came about during the course of her infection. This mutation is no joke, and it makes the virus more likely to spread through airborne transmission. It also is better able to replicate in human cells. But remember, we're still telling people the risk to the public is low. All this when there are alternatives like board cow milk, which is milk made without cows. It's made via precision fermentation, which is the same process we use to make insulin. But why isn't board cow milk seen everywhere on McDonald's Happy Meal menus and in schools? Well, because we don't incentivize that method of protein production. We incentivize cow-based methods of protein production. In fact, according to this study done for the dairy industry, 73% of dairy revenues come from some form of subsidy. And there are state and federal programs now to give money to dairies for capturing their methane and using these dairy digesters, which are basically tarps covering manure lagoons. And some dairies who do this make more money selling these low carbon fuel standard credits than they do by baking milk. And right now there are 24 federal programs used to incentivize these dairy digesters. But what if we incentivized animal-free methods of protein production? According to this 2023 article, we would save $7.3 trillion in health burdens and ecosystem degradation. And this research out of the T.H. Chan School of Public Health found that high-density livestock operations can serve as an opportune environment for spillover from wild animals into livestock or as incubators for pandemic influenza strains. Large pig and poultry farms are where the genetic reassortment needed to source pandemic influenza strains may most likely occur. But these studies don't make headlines. And we need to start to question this mainstream narrative that's being told to us and look past these headlines. The veterinary profession and most of society viewed the world like this figure on the left, the triangle with the man at the top. And really, corporations should be at the top. Women are below him, and other animals are ranked in order of their moral concern to us. But One Health shows us that all living beings are interconnected. If we harm one species, all of us are affected. And our honor is currently working hard to get these facts into the public and the media. You can check out all of our recent press by going to ourhonor.org/press. And if you have any questions, please feel free to reach out. Thank you.
Thank you so much, Crystal. Really fantastic presentations, everyone. I'd like to ask everybody, the panelists, to please turn your camera back on. We're going to begin a Q&A session. And so now that we're all really terrified too after Crystal's presentation, thanks for that, Crystal. Will the seasonal flu vaccine that we have now help protect us from H5N1?
I think there's one study showing that it may confirm some protection, but the big concern is the seasonal virus is circulating everywhere. We don't want somebody to be infected with the seasonal flu virus and H5N1 and create in the environment for the virus to reassort. So by getting vaccinated for the seasonal flu, you will help prevent a virus of potentially pandemic potential.
So those who can get vaccine should do it. Thank you for that. And so I wanted to ask, what does the recent development of H5N9 in California ducks mean for humans and animals?
We're really worried that that particular strain could reassort with H5N1. And then that could again create a virus of pandemic potential. And we'll see if that virus is becoming more frequent in more poultry flocks. That's very concerning, just like the new reintroduction of the genome D11 virus in dairy cows. We're just creating a situation where all these influenza viruses going around. And if one flock is infected with both, that would be just devastating and create the perfect environment for a virus of pandemic potential.
Do you think that we're going to be able to get that information when it's happening, given a lot of the recent, rescinding of info and stuff like that that's been going on?
But it's been really challenging. We're looking to try to figure out back channel communications. We're all kind of how do we get this information out there without having to rely on the government to distribute this information? And that's why it's so important to talk directly to the media. And I hope that people working within the federal government can talk to us so we can get this information out there. And scientists, don't wait for the CDC to release your results. Tell us and we'll release it directly to the media. That's what we got to do.
That's a great point. Just circumvent those channels and go directly to the source. How might what's going on with bird flu in the United States impact other countries?
Well, we live in a global economy, and H5N1 is already affecting Japan and the UK. I think there's the first illness of a person in the UK recently too. So it's already spread around the world. I mean, this virus originally started in China and then came over to the United States. So it's making its way around the world. There's also some trade implications too. The reason that we aren't vaccinating our poultry flocks for H5N1 right now is because that would limit our export markets. And a lot of other countries have set policy that they will not take in imports from countries that vaccinate for avian influenza. And so if we were to start vaccinating, we would lose those export markets. But it's always been like a numbers game. We lose a small percentage of birds. It's still worth it to maintain those export markets. So we choose not to vaccinate. So I think now there's some rethinking of all of this. I mean, we lost 2/3 of California's egg-laying hens. I think we lost 50% of the egg layers in Ohio. And right now we're seeing empty grocery store egg shelves. I mean, I hope that this will incentivize animal-free methods of egg production. There's already the ability to make egg protein from potatoes. and other things. And I hope that baked goods start replacing eggs from their ingredients and replacing it with animal-free ingredients. I think that's what we need to ensure our nation's food security, and just vaccinating will just, keep things assuaged right now, but in a few years there could be another virus. We're just in an ever escalating arms race against nature as it is. The only smart move is to move away from these methods of protein production.
Thank you for that.